Well, I was born in Waco, Texas on June 11th, 1929, and I graduated Waco High School. I was valedictorian of a class of 400, and then I went to Rice, what is now Rice University, but it was Rice Institute at that time. I entered in 1946, and I graduated in 1950, and was fortunate enough to be admitted to the Johns Hopkins School of Medicine in Baltimore, Maryland, where I started my training there in 1950 and graduated in 1954. And then after 1954, I went to Salt Lake City under Dr. Maxwell Wintrobe, chairman of medicine there at the University of Utah Medical School, and I got my training under him, which is one of the finest things that ever happened to me, because he was the father of modern hematology and was a superb mentor and role model. That's good. You dilate the pupils, because no matter how good you are, you can't see through a small pupil. But when you dilate the pupil, particularly if you do that in the hospital, because I have had the experience, and others like me have had the same experience, in fact, that if somebody comes along and dilates one pupil, and then the person gets a headache or something, and they call somebody else to look at him, he's got a dilated pupil, and you think, my God almighty, he's dying. He's got a unilateral dilated pupil, and it was iatrogenic, it's not God-given. Well, I don't practice medicine. I don't have any private patients. I see medicine being practiced, but I'm a teacher, and I have noticed a lot of changes in medical education. The biggest change is the change from patient-centered to technology-centered medical education. When I was an intern, we had a good history and a good physical examination and some simple laboratory data or tests, and that's about it. We learned how to do what we could to understand and create a bond with our patients. Time was not a factor. We worked as long as we had to get the job done. There was no such thing as work hour limits, and our instructors were very experienced, talented people who themselves were trained in a similar situation. And over the years, with the advent of technology, gradually there's much more emphasis on laboratory data than on history and physical exam. And the world has changed in many other ways too. The culture has changed where in my day, excellence was the norm. The next one is a 69-year-old man. You say the problem is Citrobacteremia. Diagnosis, bacterial endocarditis. Why did he come to the hospital?
Fevers and chills.
Did you read Osler's description of infective endocarditis?
No, sir.
Okay. What did he use to make a diagnosis? Do you know?
No.
And you obviously didn't read Janeway's description either. Well, the herd mentality is failure to think for yourself, to go along with the tide. And I think that's a bad development in medicine. We have today a lot of guidelines that everybody follows, a lot of algorithms and so forth. And I feel that you have to think for yourself. And what I like to think is, instead of having the herd mentality, have the herb mentality. And think for yourself, and don't be skeptical. Our system robs you of any opportunity to think. You just follow the herd. One of the best aspects or characteristics of a good doctor is skepticism. Be skeptical of everything you hear, everything you're told, everything you read in medicine, because you want to be confident that you're basing your judgments on evidence, not just hearsay. And I find many doctors today failing to think before they do something, and it can be very, very bad in terms of outcome if you don't think before you do something. And when you do something, make sure that it is within evidence-based medicine, not just something that you hear about. The biggest left ventricles that I've ever seen were in patients with advanced aortic stenosis. Very, very, very thick left ventricle pumping against tremendous pressure for long periods of time. Like this film right there. That film, I wouldn't be able to say he had aortic stenosis by looking at that film. In fact, I wouldn't be able to say anything other than it's within normal limits with a little prominence maybe of the left ventricle. You have to follow her carefully because who knows that she might develop something else that will tell us what caused this in the first place.
It's very intimidating to present to Dr. Fred, but it's also a huge honor to be able to learn from one of the legends of medicine, and it always makes me astounded at how little I know or how much more I have to know. It inspires me to try to learn.
It's a unique way, at least in the current days. What it has as a particular signature sign is the fact that rather than feeding everybody up with factoids, he will challenge every even well-established concepts, creating more questions that will bring more questions, that will bring more questions, and so forth.
And I dedicated this, which may be my best book. I say, to the countless patients who have given me the privilege of serving them, they have taught me much. Okay, well that's it. Thank y'all very much.